Welcome to Frost & Sullivan's Growth Podcast. In each episode, we take a deeper look at transformative shifts shaping global ecosystems, from industry megatrends and technology innovation to evolving customer expectations. Today, we're exploring digital disruption in wound care, how smart technologies are transforming healing, unpacking where the next wave of opportunity is unfolding, and what it means for future-ready businesses.
The global wound care landscape is changing faster than ever before. Once dominated by traditional dressings and manual assessments, wound care is now being transformed by digital tools, artificial intelligence, and data-driven insights. Between now and 2030, Frost & Sullivan expects the advanced wound care industry to experience transformational growth, driven by AI-powered diagnostics, wearable sensors, bioengineered skin substitutes, and smart dressings. These innovations don't just improve healing, they help tackle major healthcare challenges, from cost pressures and workforce shortages to the rising prevalence of chronic wounds. So, what's fueling this evolution, and who's leading it?
We've reached a pivotal point. As populations age and conditions like diabetes become more common, the demand for personalized, effective, and scalable wound care is accelerating. The result? A shift from reactive, hospital-based treatment to proactive, data-driven care that can happen anywhere, including at home. Digital platforms now enable clinicians to track wound progress in real time, while AI-powered tools predict healing outcomes and guide treatment decisions. The key drivers behind this shift include rising demand for remote and home-based care, the global burden of chronic disease, expanding digital health infrastructure, and the need for outcome-based, cost-effective care. In short, smarter wound care isn't a futuristic vision. It's an immediate necessity.
Let's break down the 4 disruptive technologies reshaping the field. First, AI-powered wound assessment tools. These systems use machine learning to measure wounds, classify them, and predict healing rates automatically, improving consistency and reducing errors. Second, wearable sensors and remote monitoring devices. These track key indicators like temperature, pH, and moisture levels, detecting complications early, even before symptoms appear. Third, bioengineered skin substitutes and scaffolds. These biologics support cell growth, control inflammation, and accelerate tissue regeneration. And finally, smart dressings and 3D scaffolds, materials that can respond dynamically to wound changes or release drugs on demand. Together, these innovations are driving the move toward intelligent, automated wound management.
Digital disruption in wound care isn't limited to developed markets. Across regions, from North America and Europe to Asia-Pacific and Latin America, healthcare providers are adopting portable, connected wound care solutions. One of the most notable shifts is the transition to home-based wound care. Portable negative pressure wound therapy devices, telehealth consultations, and mobile wound care apps are empowering patients to heal safely from home while maintaining continuous engagement with clinicians. The benefits are substantial: reduced hospital load, better patient adherence, and lower costs. The real question is, how prepared are healthcare systems to fully embrace this new model of care delivery?
The advanced wound care market is intensely competitive, with over 80 players generating more than $1 million in annual revenue. Industry leaders such as Solventum, Smith & Nephew, Moenlich, and Convatec are investing heavily in digital transformation and strategic acquisitions. Meanwhile, digital-first disruptors like Swift Medical and eCare are pushing boundaries with AI-based wound imaging and predictive analytics. A standout example, Moenlich's 2024 acquisition of PGF Industry Solutions, a move that reinforces its leadership in smart wound care integration. The industry is at a crossroads: partner with digital innovators or risk being disrupted by them.
Despite rapid progress, adoption barriers persist. High costs, limited awareness among clinicians and patients, and inconsistent reimbursement models still constrain scalability. Many healthcare systems also lack specialized wound care departments or integrated data workflows. But change is coming. As the evidence base for digital wound solutions grows and technology costs decline, these hurdles will gradually fade, unlocking access and efficiency across healthcare systems.
The next 5 years present enormous growth opportunities. First, data-driven wound care will revolutionize clinical decision-making, integrating AI and predictive modeling for more accurate outcomes. Second, Next-generation monitoring sensors will advance even further, capable of detecting infection risk, antibiotic resistance, and healing progress in real time. And third, global expansion of home-based care will create scalable, accessible models for both developed and emerging markets. These advances are paving the way for wound care that's preventive, personalized, and continuously connected.
The digital future of wound care isn't approaching. It's already here. The convergence of AI diagnostics, smart materials, and home-based technologies is redefining how we think about healing. This transformation isn't just about closing wounds. It's about using intelligence, data, and technology to prevent them in the first place. For healthcare innovators, the imperative is clear. Adapt early, integrate seamlessly, and design for the digital-first patient. The next decade of wound care will belong to those who act now.
Thanks for joining us on Frost & Sullivan's Growth Podcast. For access to our research, competitive benchmarking, and best practice frameworks, head over to frost.com or email hello@frost.com. We'll be back soon with more insights to help you stay clear-headed and growth-ready.